Hello and welcome to the show. Oh boy, you are in for a doozy today, everybody, because I happen to have my New York bestie on the other side. Say hello, Wendy Frost.
Hello. How are you?
How are you?
I don't
So,
want you to leave that out because
how are
you
you?
love to imitate me. How are you?
Oh God, if only everybody could see Wendy order something at the diner. All of your dreams about New Yorkers would all come true.
It's not that bad.
No, it's that
A
good.
little on the side, a little extra of this. We're good.
How many
Make
oranges
it.
are in your seltzer?
You're killing me. Let's get to the
We'll
real
get to the real
root.
stuff, but let
The
me tell
real
you,
root of who I am.
right, the real root is this. It's important that everybody knows that when I left New York 16 years ago, it was two pinks and a blue.
Unbelievable. Well, I have to tell you,
Yes.
they got me. I'm on stevia only now.
But two pinks and a blue, everybody, was two equals and one sweet.
No, two pinks with two
Two pinks and a blue,
two
sorry.
sweet lows and an equal. Don't tell everybody already that I'm a sweetie. But I'm trying to be a stevia girl or anything natural leaf, or I'm trying.
We're all doing our best, girl. All right, so
Agreed.
why is Wendy Frost, my bestie, my New York bestie, on the show today? Well, she just so happens to be the greatest nurse practitioner in the world.
So glad you think that.
No, it is true. So Wendy took care of my vagina for many, many years while I lived.
And it was a pleasure.
You know how many
So
people?
glad
So many people have thought it was weird. They were like, "You went to your best friend to have your gynecological needs?" I'm like, "Yeah." Some of the best.
I have a daughter. A daughter begged me. I said no. Of course, I have one daughter who said, please see me. The other one is never look at me. So I have two daughters. One was like, can't you just take care of me? I said, actually, no. But I did do a little something for her.
Of course, that's the Renner. I mean, I know that.
It's Corinne. We could also call her the Renner. That is true.
We have many nicknames. When you're from New York, that's what you do. So we got Ken Man too. We're going to throw in the mix. Ken Man sells the most amazing office furniture, has sold a lot of office furniture. In fact, for a lot of my clients, I highly recommend you look up his office furniture company.
And that would be B and C, office furniture. B as in Brooke and C as in Corinne. So they have been our lucky charms for many years now. He's in business way over 20 years. Way over, maybe 25. And he's very successful, and he's the easiest and the most delicious man to work for. And
all right, already enough about him.
Okay, can't help it. He's been my lover. He's been my lover since college.
Well, not just that, but he works with mostly medical practices. So there you go. There's your little
many. He is a sole provider for Shine Pharmaceuticals. So he's doing well. Lots of medical in this house. He thinks he is a part-time gynecologist, but I told him he is not.
He is an expert. All right, so
he's a super expert.
He's an expert. So of course this is so much fun for me because I adore you, and we have been in each other's lives for 24 years now.
Yes, we are.
I have watched your entire family grow up, get married. Brookie got married. Renner is like a math teacher. We weren't sure how it was going to go down with Corinne. She is one of the smartest humans ever, and I had nothing to do with it. Damn it.
Right. And I did have something to do with it, but I really didn't. She's upstairs being a high school math teacher during our COVID-19. She's teaching 8th grade math from home for the Department of Ed, New York City. So I'm very proud of her. And my other daughter is on the front line at Lenox Hill Hospital, taking care of many COVID-19 patients. And so far, she's been nice and healthy, even though many of her colleagues have been quite sick.
Yeah, so that'll just bring it down to a real serious note here. I will
Sorry.
never forget. That's what, we have to. This is a very serious time. When you sent me the picture of Brookie, I felt a little sick because, of course, she looked like she was in, a Martian's outfit. The
I
whole,
know.
yeah, the hazmat
I
suit.
know. And she, they get, for those people that wear the N95 masks and things like that, you get all irritated in your nose. And so she'll call at night after she showered, and she's all red and cut up all over her face from the masks. It's what they are doing is really remarkable. And I'm proud to be a nurse myself, and even prouder of my daughter.
Well, I'm so super proud too. And
This
I
is
am
not about crying. There's no crying here.
so proud of her. Well,
You can talk about vaginas, it'll make people start laughing.
well, we started at vagina and then we go to crying, but this is a typical Dr. Whisperer show. We should be very open and we should be very honest. And the more that we can laugh, right? Because laughter is the best medicine, the more we might forget temporarily what's happening in the world. But knowing that I have people that I adore taking care of the humans in New York makes me feel better about progress. So super proud. What has it been like as a mom to Brookie right now as an RN in the hospital?
Well, about 8 months ago, maybe more, she got this really nice nursing job. And it was with the cardiothoracic surgeons, and they pulled her right off the intensive care unit into the office. It's like a dream job for a nurse for 12, 10-hour days. And then the office was just closed. They weren't doing cardiac surgeries, and she was deployed. They used the word deployed, and it's exactly what they did. They took my daughter and they sent her off to war. And that's exactly what it's been there in the hospitals on the front line. It's been a war. And that's why all the exciting cheering when they discharge patients, it's a miracle that they all, we have discharged many more than died up here. And it's a very dense city. We're at huge risk up here. I'm praying that people will take the recommendations to heart so we can all get back to work, including myself. Right now, I am doing a lot of telemedicine, but mostly I am seeing emergency gynecology patients, which there are. Yeah. There's a lot of itching and burning and all sorts of stuff, even though I know what you got and I could tell you over the phone, nope, I need you to see me. So right. Come on in with mask and gloves and I'll see you. And I have done that. And I also do obstetrics. So yes, I've been seeing all these pregnant women who are full of fear about delivering. But the good news is their spouse is going to be with them at the delivery. The rules up here are that you pack up your husband, you pack up your partner with lots of food and clothing, because when they walk in with you into the labor and delivery room, they're not leaving. They go to the bathroom there. They cannot leave. They will both be tested for COVID-19 and they will be there. Once the baby's born, they could stay together for 2 hours, and then the husband will not see, or the partner will not see the patient or the wife or until discharge. So it's quite different.
Yeah,
do this on their own. So I'm helping a lot of women. I'm trying to allay some of their fears when I see them in the office, that it will be okay. And that, and they're asking me all sorts of questions. The good news is that we know that the babies aren't getting COVID in utero. But if the mother is positive, the baby could be positive after the baby's born. So it's been hard. We're all listening to the experts at the CDC and, the HHS and all of that. And hopefully this will, we can go back to work and back to our jobs.
Yeah, people stay home, wear a mask and do that whole,
I agree. And I think you were right. Before this, we had we talked about that things are not going to go back. I think huge companies realize that it's okay for a lot of their staff to work from home. I think that they're going to get smaller office space and spend less money, and half the staff will be in and the other half will be home and back and forth. I think there's going to be tremendous differences in business.
Nobody's going to the office anymore for a follow-up visit when they can do it over Zoom. So just everybody stop. Enough. I'm tired of it. We're over a month in now. And if you think that people are going to get dressed, get ready, drive in their car, send some more CO2 up into the atmosphere while Mother Earth is having a fabulous time taking a break and allowing some type of, clean air to flow through our world for a little while, it's never going back. So get your telehealth game on, everybody, which I'm so happy that you already have. You have been practicing for how many years now, Wendy?
I became a nurse in 1980, and I'm proud of that, but I've been doing my love job for 25 years. I became an NP May of 1995, which will make it 25 years. Oh, May is now. I have 25 years. Yes.
Yay!
And I have developed loves for different parts of the practice over the year. I love to consider myself the specialist for the first visit.
What you love right now, though, Wendy? What you love?
Oh, well, my love right now is bioidentical hormone replacement.
Yeah. Do you think
I am
you are an essential worker for more reasons than you could even?
That is true. I am a perimenopause, menopause, premenopause,
oh, forget
polycystic
that
ovaries, all that good stuff.
Stop it. You're going to prevent more deaths to husbands. The woman is going to actually kill that man that she's living with if you don't help her.
When a woman comes into me and says, I think I might kill someone, I could fix you. And all really it is, Sharon, it's so simple. It's basically putting the woman back to just the way she was.
Yes. And you do.
It's not giving anything special. I'm just kind of just replacing what you had as natural as it was.
I love what you call it. I love what you call this whole world that you're in with your bioidentical hormones, but I want you to say the name.
The name is Restorative Health.
Amen, sister. Restore your health. I mean,
that is correct.
Restore it.
I mean, and many people would, also they feel that it's prevention. It's also prevention, because there's so much data out there that, that the hormones will prevent cardiovascular disease and Alzheimer's disease and osteoporosis. The data is booming strong. It does not cause cancer.
Thank you.
So, but I have to teach that. And, somebody puts out 20 years ago that one drug in the market had a higher incidence of all sorts of crap.
No, we're
not doing any of that.
Listen.
Well, we have to do we have to unlearn.
Whose show are you on? You guys have you're on a show with two New Yorkers, everybody. Welcome to it.
Right. Anyway, there's a lot of unlearn.
Oh, I just muted her. Everybody, I want you to pay attention really quickly while I've muted my best friend in New York. It's very important for you to hear. The reason that we're not going there is because that is old news and this is 2020. So if you're not up to date on what is actually happening in the world of bioidenticals, we don't have that kind of time to help you. If you need help, now you know what you need to do. Okay, moving on. Wendy.
The only thing I was going to say, I have to finish that statement. My job and career is about a lot of unlearning.
You are not lying about that. Okay, I want to tell you guys a quick story about Wendy. So Wendy, like I said, my gynecologist for many, many years. I would say one of the hardest things about leaving New York was leaving Wendy and Kenny and Brookie and Renner and now Lucy the dog. But it was very difficult to leave who I became very comfortable with, because a woman going to see a gynecologist, a woman going and showing off her hoo-hoo, whatever it is, whatever issues you got, it's a very personal matter. Well, when I was in my early 20s, I had an ectopic pregnancy. And I went to see Wendy, and it was President's Day, and the office was closed. But Wendy still it's good to see your best friend, actually, see? Because Wendy allowed me to come in. And if I did not go in that day, and if she did not do that ultrasound, who we now call Waldo, where's Waldo? We could not find Waldo. I had to go in immediately and have this procedure done. And I could have died if it wasn't for her. So for me to leave that and having that kind of trust in somebody and having this kind of, issue from a very young age, and then not being able to have children, but having somebody that could walk me through all of it was one of the best and greatest things about our relationship that I don't think that, Wendy, you get enough credit for. So I love you, and I want to thank you publicly for that, because it meant the world to me that I had you to take care of me. Good, cry. Why'd you cry about it? But listen, more important, one of the other things I'm going to tell you that Wendy would never say about herself, and this is definitely the reason that I know that she has always had such a big following and forever will. Wendy loves people, which means that when you go to see Wendy, even if it was a year, she's going to know about your kids or the grandchild that was just brought into the world, your sister, your brother. She's going to know all about that. And this is why people go see great practitioners. It's because we like you. So we like you, Wendy. And it was very, very difficult for me to find somebody else. I did find somebody that I really like. Her name is Brooke. And if she's watching, I do really like you, Brooke. But I've told you about Wendy almost every time I had a visit with you. Because I wasn't laughing as hard. Okay, she had a coal miner's light looking in my hoo-hoo.
Yes, I did. When the light went off, I do have a backup coal miner's battery operated light. I just say, scooch it on down, and out the light comes. It was great. Or I have my assistant use the flashlight on her cell phone to help me.
I just think it's great.
We've had table lights go out on us. It's okay.
Wendy Frost, nurse practitioner extraordinaire, has also been featured on Say Yes to the Dress. She has also been featured on the Long Island Medium.
Yes, Teresa Caputo is a patient of mine. I didn't even know that she was famous when she walked into my office. So I acted like, but that was quite a few years ago, and she's been very good to me. She enjoys me because I take care of her daughter and her daughter's best friend and her assistant and her trainer's wife. And anyway, that is a flattering thing. When you get everybody you love to come, I can't be any more flattered. And she's a lot of fun, and what you see is what you get.
And, here I am thinking one day how great it was that you and I were on Say Yes to the Dress. Once I dropped Teresa Caputo, it's over. Who is Sharon? What about Wendy? Tell me more about Wendy. But you deserve that, because you light up a room in any room that you go into. And that is a sure testament to who you are and how you practice medicine. It transfers into everything that you do in life. And I've always said, and you know this about me, how and who you are in life is how and who you are in business. So you've now met Wendy. You know how amazing she is. She would take care of you and your kids and a psychic medium if need be.
That's true. And every time she comes, it's all about her. And I say, are my parents here? So in the middle of an exam, I'm like, so could you tell me if my parents are here? So she does not. I'm just letting you know.
Bad. I would have loved a story like that.
Oh, I have quite conversations with people during exams. It's an uncomfortable exam, so I'm right in there making them feel as comfortable as I can. I love what I do, and I think it comes across.
Oh my God. Well, that's one of the things I was going to miss most. I knew that it's such an uncomfortable, guys, if you're watching, you're never ever going to know what it's like to put those feet in those stirrups and have your private parts exposed to a human that you don't know. In the light, not in the dark. So to have somebody that makes you feel comfortable is actually everything. And I'm not just saying that because I stay at your house when I go to New York. And that's the only house I'll stay when I go to New York.
And if you stay anywhere else, we're breaking up.
I know. I can also have frozen yogurt from, what's the name of that place that Kenny used to get the frozen yogurt from?
Oh, Hewlett Station. There's a shout out for Hewlett Station.
Hewlett Station, and there's like
Hewlett, New York.
There's like a BOGO on Sundays or something. Rob always thought that was the best.
Very close, but it's on Saturdays and Tuesdays, I think. But what else?
Wendy, so listen, we, just so everybody knows, this show, I put the timer on us because we were on. What time did we start, me and you? So it's 5:48 right now. This will be on some, I don't even know what day it is. Who knows what day it is in quarantine? Thursday. It will air at 5.
Groundhog's Day. It's Groundhog's Day.
But we started at 4. So we were talking to each other for a whole hour plus before we got on this. And you would think
that's because the Dr. Whisperer is so busy. She's the one to get, babe. She, you can't even talk to her, even if she's your BFF. But we leave each other messages. I'm definitely behind. I need to leave you one. And it's the greatest way to go to work. You just listen to message after message. There's no, she doesn't have to cut me off. She doesn't have to put me on mute. She just talks. And then I call back and give her the feedback.
But it has been the greatest. And I know that there's been so many people that I've referred to you through the years, because I know that the fear that women have when maybe they are having a hard time getting pregnant, or maybe they're unsure about, the pap smear information that came back, or the birth control, or, I'm afraid to get off birth control because I heard about all of the things that can happen. I mean, you were a real source of information for not just me, but for so many. So do you want to leave these fine folks that will be watching you with any, recommendations, even through COVID-19 right now? Because I know that even though you're looking at the hoo-hoo, you're really treating a lot of mental health issues.
If you're a woman, there are mental health issues that come along with all of it. And I am just, it's a privilege. It's a privilege to do what I do. I work hard, I study hard, I go to lots of courses to make my brain better. And basically I learn it here, and then I just put it on you. And women all through their life cycle is my specialty. Right now, I have a real love for bioidentical hormone replacement, and that's because I've seen the miracles that it does, that it's transformed women and men. I am taking care of men now too, which is very different for me, but they are extremely grateful. And no offense, women, they are so much easier than us. They have no complaints. Just give me it. I'm happy. And I make them also, back to the men, they've got problems that they want to share, and I can help them with that too. So women throughout the life the life cycle, including all of it, including, that first GYN exam and birth control, and then when you want to have children, and then getting you through the pregnancy and having that, and then perimenopause, and now menopause, and helping you stay strong, stay healthy, and
I love that you're providing
restore.
And you're providing telehealth. So one of the things that I love about what you're doing is that when I have a friend that calls and says, well, listen, it's COVID-19, because a lot of people call me and ask me where to go. So I was really limited for a time that I had to just tell people here in Tampa Bay, because it was like, where were they going to drive to? Well, now, there's that unbelievable opportunity for you to see people from anywhere. So to be able to do a consult over the phone, there's blood work involved that you don't have to do. I mean, you're not shooting out blood work through the laptop, from what I understand, yet. Maybe
I haven't figured that out.
You never know. But I really do.
I've not figured that out.
It's a great advantage that we have telehealth now. So Wendy being available to do consults and to get people up and running so you don't kill your spouse is a good idea through this COVID-19 quarantine, right? And to feel good, and to have strength, and your brain feel better, and all of it, your metabolism. It's an overall wellness.
It is a
And happy
wellness that
birthday.
I have for me, and I want to give to others. I love the way I feel.
Yes, and I'm sure Kenny is very grateful as well. And happy birthday to you, and
Thank you,
belated happy
Pumpkin.
birthday to Ken Man.
Thank you, Pumpkin. We are 10 days apart. He lets me remember that I'm so much older than him. And I'm so much older than you, Dr. Whisperer, but it's okay
Please.
because age is just a number. And when you're doing bioidentical hormone replacement back to the way you were, I'm so much younger than you.
I know. Can you say for everybody, do I have to wear taffeta?
So I have to wear taffeta?
Wait.
Yes. I told Sharon that I was too old to be
For
somebody's maid of honor. And that is not true.
Wait, now hold on. What was the thing that everybody makes fun of that you say?
I'll tell you. You mean during Say Yes to the Dress?
Yeah.
Brooks,
Yes.
yeah, Brooks' friends still say it. You're the bride. You need to be a little special.
You're the bride one time. That's what you said.
You're the bride.
All right. I love you to death. Thank you for coming on the show. I hope I'll put all the information
Really, I'm
with you.
It was an honor.
You're the best.
It was an honor. Thank you, Sharon. Sharona.
All right.